I have a question.
Sure.
What are the different areas in psychology? Because I am completely unaware about all those things. Though I'm studying little bit. I'm studying. I have just started, but I don't know the entire thing because my background is engineering background with 10 years of experience in academics as an assistant professor. And now I'm pursuing preparing for PhD. Yeah. So I'm very much keen to I'm very much interested in this psychology field also because my research area is something related to like emotional intelligence, NLP. Means we are just merging things into our chip design part. So my expertise is on VLSI chip design.
Okay.
So we are just connecting both the field together.
That's an impressive thing that you are doing, ma'am. Absolutely. Yeah. Surely. So
10 years ahead work. Actually, it has not implemented till now. It is 10 years ahead. This work will be. So I want to know each and every area because I am completely new to this area. So I want to know about what are the different areas of psychology.
So, okay, altogether, if I just upon what is psychology, there are 10 fields. If I talk about, there are holistically 10 fields. So, number one, if I would talk about school psychology. Second one is psychology. Third one is clinical child psychology. That is a bit different one. Then there is health psychology. Then neuropsychology is there. Marriage and family psychology is different. Then again comes upon the forensic psychology, which are all there into investigations, CBI and everyone. There is this institute, National Forensic University in Gujarat. So they are basically working upon that. Then the next one is rehabilitation psychology. So MPhil in clinical psychology and MPhil in rehabilitation psychology. So there are 2 degrees. So rehabilitation psychology is different from clinical psychology. How? That rehabilitation psychology are working in the mental hospital itself, but working on how to change their lifestyle. The clinical patients, the chronic patients होते हैं, so how to change their lifestyle so that they can accustom to the again back to the society. How do we change all the things for them to be able to function properly in the society? Then again, the next one is addiction psychology. Then sports psychology is there, and that is it.
Okay. So may I know about something about neuropsychology?
Okay, so neuropsychology mainly it is all relatable to the brain area. So if I talk about the diseases which they actually deal with is dementia, Parkinson's disease, then traumatic brain injuries, seizures, then learning disability. So these all things comes upon in the specialized branch of the psychology, that is clinical neuropsychology, which you will only be able to deal with after you are having MPhil clinical psychology. So this is a specialization program that is there. So basically, like I'm over with my MPhil degree. Now, if I do my PhD, my thesis work on neuropsychology, someone does like if I work with Parkinson's disease patients, or let's say if I work with the dementia patients or traumatic brain injury, then I'll be specializing onto that field, and accordingly, I can practice as a neuropsychologist in India.
Okay.
PhD in neuropsychology is there in NIMHANS, in AIMS Delhi, AIMS Bhubaneswar, and Rishikesh. That is it. And apart from that, and CIP is also having Central Institute of Psychiatry in Ranchi. Yeah. So these are the few institutes which are running that. But then proficiently, if I talk about neuropsychologists are really in handful number in India. Like we can count, I can tell you about the four neuropsychologists. Sorry, ma'am?
Very specialized. It's a specialized area.
Because the area is quite complicated. Because in this area, we need to work with the neurosurgeons, neuropsychologists, as well as the specialized area of all the sectors.
Okay.
Yeah. Okay. So that is how
interesting.
Yeah.
It's quite interesting. Yeah,
it's quite interesting. Even I had my prior idea, even the research idea that the proposal for MPhil degree that I had proposed, it was on neuropsychology itself. It was on EEG, electrical encephalogram, EEG on epileptic patient. So it was onto that, but then it got rejected because of a few dimensional problems. So that is it.
Okay. Thank you, ma'am.
Yeah, sure. All right. So the question that was asked, it was on medical psychiatric social work. That is so medical psychiatric social work is something. So this field is basically, we, in our institute, we are also having MPhil in psychiatric social work. So they are basically, they are aware of all the things that a clinical psychologist does. All the testing, they are very pro with that. And what they do is, they basically are the forefront of the mental health awareness program. So basically, medical psychiatric social work, you are onto that field, and creating all sorts of mental health awareness, and making the people come till the hospital. It's a big gap between that. So medical psychiatric social work is something which is a very important field in this in India. And apart from that, there are ample number of jobs out there from the government institute for medical psychiatric social work. And to answer, I'm Robert. I am into sports psychology. What should I do? Okay. So for sports psychology, you should be knowing the basics of the psychology, surely. And apart from that, you should be knowing about the child psychology. Why? So as to have the grip upon the physical activity or the motor development of a child, and what issues, what environmental issues that they go through while they are into their adolescence period. If you as a psychologist are not aware of that, then the connection for you to build with the child will be a bit problematic here. So I'm assuming that being into sports and being into sports psychology, you would be dealing with many children. So yeah, so child psychology will be benefiting you in that manner. Oh yeah, sure, Kirti ma'am. Yeah.
Yeah. So I wanted to know the difference between these terms. Like, what is the difference between a child counselor, a therapist, and a child psychiatrist?
Okay, sure. So I'll be answering you once. This is an important question which will be covering. We will be covering in the upcoming presentation as well, and after that we'll be differentiating it accordingly. Sure. Will that be okay? Yeah. Okay. Should I start now? Should I share my screen? Yeah. Okay. Thank you. So to begin with, so this is the whole slides will be covering up only the introductory part of the whole thing. So child psychology is a part of developmental psychology. So child psychology is not a holistical part. So it is coming from the developmental psychology altogether. So developmental psychology is different from child psychology. So in developmental psychology, we are covering onto the development, like the biological part basically, and child psychology is covering up the psychological part. Okay. So as it studies the growth and the development of the child from the conception till the adolescence is what we call the child psychology. So studying the child is helpful for understanding adult behaviors, as most of the adult personality and behaviors are the result of the child's experiences. So moreover, the development is much faster in early years than in later life. So both the development and the child psychologists confine themselves to in the in-depth study of the behaviors during the early parts of the human life. So as we know that when a child comes on this earth, so you will see that their development is quite rapid. In the very initial stage, it will be quite rapid. Okay, in 2 months, the weight is increasing, the motor activities are increasing. The child is able to their eyes and their mouth, but the babbling and everything gets very fast changes there. So this rapid change occurs in the first 5 years of the child's development. So the developmental psychologists study the cognitive, emotional, and the motivational development during the entire lifespan of the individual. It covers all the lifespan stages such as infancy, childhood, adolescence, adulthood, and the old age. So developmental psychology will be covering everything. So even I will be covering the developmental part, since it is important for you all to know the developmental psychology so as it becomes easy for you to understand what is child psychology, because that gives you a biological foundation to understand the child psychology. It becomes like easy, like the way we know ABCD, and it becomes for you to form the paragraph and to talk efficiently. So similarly, developmental psychology is that important to understand. So this field focuses on the developmental changes in the perception, learning, thinking, emotion, language skills, personality, and social relationships. So this is what the developmental changes that we will see in the child psychology, which has to be known from the developmental psychology. So that is the reason that why developmental psychology is important to understand child psychology. Okay, so moving further. So for each stage of development, it identifies the needs and the challenges faced by the individual. So it also studies the developmental pattern of special group of people. Child psychology. So in this, child psychology studies the same basic psychological process in children, emphasizing the role of heredity and environment in shaping the behaviors in the early years of life. So for a male body and for a female body, or let's say any X body, okay, the child, any body which is having any kind of, let's say, some developmental delay is there, or let's say some chromosomal chromosomal aberrations are there, or any kind of such development. So their development is quite different. Okay. So to understand this, before understanding this development, we can't be understanding their psychology altogether. So which is why the development for each body is different. So to understand that, we will be studying developmental psychology first, and after which we will be covering the child psychology. So child psychologists help the parents and the teachers in providing guidance for the children development and education. So if I talk about, so in one liner, what I can say is that developmental psychology is much on the research base compared to child psychology. Okay. So developmental psychology won't be like studying the psychology part as a holistic way, as a holistical way, like environmental factors, or let's say एक बच्चा स्कूल जाता है तो उसके साथ क्या होता है नहीं पता. But that particular portion will be known by the child psychologist, not the developmental psychologist. The developmental psychologist will be knowing at this particular stage what are the activities that a child can do, or what all the changes that happens in this particular age group, but not what kind of environment they are accustomed with, and what kind of situations they have to fight with, is what the child psychologist is accustomed to. All right. So
Ria, 1 second. Can you please go back to slide number 2? Because I want to know about developmental changes. Yeah. Oh, just for 1 second, actually. Developmental changes. Slide number 2.
this is the slide number 2, I guess. Okay. Are you talking about this?
Yeah.
So we'll just revisit the concept again. Okay. So the child psychology is the study of subconscious and the conscious childhood development from the prenatal development to adolescence. What kind of, what is subconscious and conscious? I hope that you all are aware that the mind has a structure. Yeah, unconscious, pre-conscious, and conscious. Okay. So this is what psychology is all about. So mind has the structure, and we need to go through that first. Okay. So subconscious and conscious is something which we gain from the environment, and which is the part of child psychology. So which is why the statement has been written as child psychology is the study of subconscious and conscious childhood development from the prenatal development to the adolescence period. So prenatal matlab when the child is into the embryos, into the uterus first. So we are talking till from there. So any kind of trauma to the mother is also seen in the child when the child grows up. So we are taking that portion into a very important factor. So currently when I deal with any child, so there is this important mental status examination questionnaire is there. Okay. So in which it is very important first to elicit from the parents that what kind of, was the prenatal development all good? Was the gestation period all normal for the mother? Was the childbirth were all normal for the process? Because if there is any issue at that point, like after the birth or during the birth, there are many times that the umbilical cord gets entangled into the onto the neck area, and which is why asphyxia is seen. Asphyxia is loss of oxygen for a momentary period, and which impacts onto the brain development in the further stages. Then I'll be talking about that in the later sessions, about what kind of complication leads to what kind of issues. So we should be knowing about that. So the next point is it studies the child physical, cognitive, and socio-emotional development. So you can see that it's talking about the environment altogether. कि environment से इस बच्चे पे जो भी आ रहा है, we are able to understand that, which is known as child psychology. So it is specialized branch of developmental psychology. Developmental psychology is very holistic, very big. Okay. A part is known as child psychology. Okay. A child psychologist is an expert in childhood development, works with children and adolescents to diagnose and help resolve issues that cause emotional and behavioral issues. So it is very clear from this statement altogether that a child psychologist need to know about development, so as to tell that, so to give that information to the parents and to the teachers or whosoever they are dealing with, so as to understand and diagnose that kid as well. Otherwise, he or she won't be able to. So if I get more onto clearer picture to this, I would be giving you the example that MBBS जब करते हैं, so that is holistic, everything, right? And then MD or MS is a specialization, right? So we need to have the idea of the whole body system, how it is working or what is leading to, so that when we do the specialization, at least we know what might be the cause to this particular problem. Okay, so that is how child psychology and developmental psychology is distinct yet similar. So it is an important field of.
Can I ask you a simple question here?
Uh-huh.
My question is, why have abnormality in some children? Why abnormalities occur in children? Means what is the main cause for that abnormalities? Means some children have means they're not able to talk properly. Different types of abnormalities are there. So what is the main cause of that?
Okay, so main cause are many things. Main cause are many things. It might be hereditary. It might be some loss of some nutrients in the mother while she was onto the prenatal period. There might be some accidental issues in the initial stages of the life. There might be some loss of oxygen at the time during the birth, or let's say there might be some loss of blood during the there might be some cut in the body, or let's say there might be some chromosomal aberrations. Like
Okay.
type of so Down syndrome is there, autism is there. There are many things. We'll be talking
Yeah,
on it.
yeah.
So that is
Okay.
all kind of issues. Yeah.
Mm-hmm.
There are
Yes,
many
yes.
times that amniotic fluid gets into the ear as well, which is why there is this hearing impairment that is seen. So there are
Mhm.
many kind of complications that happen at that time. There is there is this alcohol fetal syndrome in which if the mother consumes alcohol or any kind of drugs during the pregnancy period, there are abnormalities seen in the children. So it is an important child psychology is an important field of psychology. It is help as it helps us to better understand our kids mature as well as how best to support them to become well-grounded individuals. Yeah. So it is therefore useful in assisting both the parents and the teachers, and also the community as a whole to better understand children and their care. So again, I'll try to revisit the concept. So child psychologists can help children cope with. Here I am talking about what can be helpful for the children being a child psychologist. Okay. So child psychologists can help the children cope with the problems such as anxiety, depression, substance abuse, hyperactivity, bullying, and risk section sexual behavior by educating them and providing them with counseling services. So this can be only understood until and unless we are not holistically understanding the kid, how the kid is developing, how their parents' behavior are influencing them, how their home environment is getting influenced, getting like shaping them into some other kind of individual. Until and unless we won't be able to distinguish among these disorders, and we won't be able to help. So child psychologists help a child through anxiety, depression, substance abuse, hyperactivity, dissection, sexual behavior by educating them. So this educating them is what in our field we called it as psychoeducation. Okay, the psychoeducation, like psychoeducating a kid about anxiety. That kid is having so many of the school refusal. You have heard about the school refusal kids. The kids who are throwing tantrums and showing a lot of hazardous activities for not going to the school. So the idea. So what might be the reason behind not going to the school? There are ample number of reasons where when we work with the child of these kind of issues are there. So we do different kind of tests, like let's say Broadman test, house tree person test. There are few projective tests like children apperception test is there. So all through all these projective tests, we get to know the idea that what is going what is the problem that is what is the issue exactly that is going on to the child's head, and what is leading to the school diffusion. So these are the few things that a child psychologist must be clear about, so as to help the child as well as the family altogether to get out from that issue. Okay. So that can be done through counseling services. So they also help children to deal with conflicts with parents, stressful events like divorce or a parent's death. Let's say a child studying in class second standard, and there's a separation that is going on in their in his or her home environment. That is a very big thing for the very big event for the child, because the child is something somewhere configuring that something is happening, that मम्मी अब आती नहीं है उतनी बार जितनी बार पहले आया करती थी. पापा बात नहीं करते हैं, प्यार मुझसे थोड़ा शायद कम करते हैं क्योंकि पापा घर पे नहीं रहते हैं आजकल. So these all things then gradually shape onto the further years. And when the child, let's say, is studying in 10th standard, actually not so onto that we are getting to know that there is some disorder altogether that has been formed. We'll be talking about what kind of disorder might be leading to that. Okay. So this is what happens as a in the different environmental issues that happens in the child's life. So a child psychologist is accustomed to handle all these situations, like what is now a couple going through a separation, let's say, and they are having a child, then how to handle that situation altogether, because you can't be like throwing like saying it to the child like कि मम्मी पापा अब अलग अलग रहेंगे तो मम्मी पापा अब अलग अलग हो गए हैं, because he will be going to school and watching other children that they are all happy in their family and my parents live together, but why not me? So we need to give proper answers to all these questions for children. Yeah. And the third point here is emotional and mental behavior disorders that affects the children are often treated differently than adults. So any kind of issues that children are like going through or are asking for, so that has to be dealt in a very softer manner altogether than what we do with the adult population. Children are something that so here child psychology is something that has to be dealt with very much of softness and too much of patience, because here children will be onto like they are exposed to all sorts of issues that even like you as children, if you would have you would have gone through those situations, you wouldn't be leading a good life. So we need to be very soft and very considerate while dealing with the child population. Here I was talking about the qualities of a child psychologist, like the previously what I was talking about was the qualities. So here we will be talking in much more detail. So opting for a career in child psychology requires a good communication, first of all. That you should be a very good communicator. There shouldn't be anything that, oh, now how should I deliver this particular concept to the child or the parents or the teacher? Like, how do I make them understand this? So this is where the communication, if there is any communication lag between you and the client, then the things are not going anywhere. So your role as a child psychology or as a psychologist would be failing. True. So that is the reason that if you are opting for child psychology, and let's say if you are opting for this career in psychology altogether, communication skill is especially the listening skill is something that you should be having in proper. Like first listening what the client has to say to you without missing on to anything. So that active listening is very important in this, and I'm sure that you all are aware of this fact, and an ability to build rapport, trust with the parents and the children. So the first thing is that the child shouldn't be afraid coming to your clinic altogether, coming to you on the very first place. So what I do in my hospital as well, I don't know, I do that, but there is no there is no suggestion, or there is no criteria that you should be doing like that or doing like this. This one is not, this particular thing isn't written in any of the books as well. So I carry a soft sponge ball. So whenever a kid is coming and I know that a kid is going to come for today's session, then I just from a very far, when I got to see that kid, let's say it's a girl or a boy or anyone, I just say, "Oi, pagad catch." So I give the ball to that kid. So I'm like, "ये मैं कहाँ पे आया हूँ? What is this place all about? Why did she give the ball to me?" ठीक है. So this playful activity, then I ask, catch back, वापस दे. ठीक है. Then they give it back. Then I go again catch है, इस बार पकड़ना है. If they miss it or something like that. So then they come to the cabin and then we start talking. So this is something कि यहाँ पे बच्चे को कहीं ना कहीं थोड़ा सा it will be like कि नहीं इतना कुछ harmful environment नहीं है, because hospital setting में it is always very stressful for the kid as well कि आज आए क्यों है, कोई तो बीमार है नहीं, no one is no one is sick here, why have we come to the hospital then? Because so for me, because I'm currently into a mental hospital altogether, all the schizophrenics, all the psychotic patients are coming, all howling patients are coming, and onto that when a child walks through that corridor, it's very like a panicky situation for them. So what I do is this. Okay. So again, the second activity that I do is blowing up 2 balloons and giving one to the kid and like like blast it, poke it and blast it. So the kid is very happy after doing that. So this is what I do. So we need to indulge in these kind of activities so as to at least make them a bit comfortable with the whole environment altogether. So psychologists, so child psychologists must be very patient, empathetic, and good problem solvers. They should be like a natural process should be there. You are able to at least solve few of the problems, because everything is not there onto the books. Books are there for your holistic knowledge, of course, but those metaphors, those ideas, those creative choice of words at that particular client interaction, like client therapist interaction, you should be very very pro with that. So to develop all these skills, I would suggest you all to read normal books. Okay. And then talk as much as you can in your vicinity, like people around you, like build rapport with them, so that like they become comfortable. Check on yourself, how efficient are you becoming by making the other person comfortable with you, so that they can share whatever they are feeling. So this is the first thing that a psychologist must be possessing in them. Not all can actually make them ये comfortable enough कि हाँ वो अब अपनी problems तुमको बताएगा, नहीं बताएगा. Nobody will be saying, and they will be like कि नहीं उनके साथ तो इतना अच्छा नहीं लगा, मतलब कहा वो शायद समझी नहीं. Why that other person समझी नहीं? Because this person, the psychologist, wasn't able to have the empathy. Now, how to show empathy? Empathy and sympathy are different. I hope that you all are aware that empathy and sympathy is different. So empathy is something ki, okay, a friend coming to you and saying ki, yeah, this happened and I'm very sad. And you're like, हाँ यार, I can understand कि भैया, okay, you are sad. So sympathy is something that you can just give कि हाँ, you can sympathize with that person कि हाँ, that person is unhappy or something like that. Empathy is different. Empathy is that imagining the whole situation occurring to you and how would you feel, and that would automatically change your expression and your body language and the way you talk. Everything, it will be changing. So it is a very tough job for a psychologist to actually be empathetic and to have that conversation with the client, because that actually takes a toll on your mental health as well as a psychologist, for you all to go through that. So the third point here is there should be a genuine enthusiasm and a sense of caring for needs of the children. So that the activities that I do, so it should be very genuine. It shouldn't be like कि अब करना पड़ेगा यार, बच्चा आ रहा है, so I need to do this. Okay, now I need to blow a balloon and keep it for the kid. Okay, I need to take that that ball and say catch. Even I am like least interested कि अब मेरे को catch करना भी नहीं, खेलना भी नहीं है. So if there is any kind of lack of this enthusiasm, then you will be anyway not be able to like deal with that whole case itself. So there will be no enthusiasm there. So you won't be getting any energy to invest into that case and to understand the whole problem as a problem. Okay. Till the time that you are into some problem of not having that enthusiasm altogether. So this is something like that. So the key responsibilities is as a child psychologist that one should be possessing as a child psychologist if you are working, that assessing psychological, intellectual, cognitive, and behavioral issues with testing and evaluation. So there are different types of testings from BSMS, that is Vineland Social Maturity Scale, to children perception tests. There are many tests. So that is like for in India to have a standardized to get a standardized IQ report, there are few tests that has to be conducted by a clinical psychologist, so as to give the IQ report to that family. Let's say a kid. So why IQ reports are important? So those are important for the schools, so as to deal with that kid in a different manner. Or let's say if the IQ report says that the child is onto borderline, or let's say severe profound range of IQ, then they have to be shifted to some special school for that. For that reason, IQ tests are very important. The second point is using interventions such as psychotherapy, that is the talk therapy, and behavior management is there for all the behavior that the behavior modifications are done in such cases. So that is done by a child psychologist. So these are the interventions. So how a problematic behavior can be changed. So these are the interventions that we apply onto the family as well as onto the child. So we'll be talking about future psychotherapies as well. What kind of psychotherapies are available and to what problem, what kind of therapy is given. The third point is developing prevention programs such as preventing bullying, addiction, teen pregnancy, etc. So these are the programs which so as Swati here has mentioned about the psychiatric social work. So these are so for this preventive programs and all such programs which are basically for awareness It's done by psychiatric social workers, and they are very efficient onto that, since they are and the first skill that they are very good at, orating skills are very good in psychiatric social work, because they are previously oriented to all those kind of speaking onto in front of 100 people, so they are really good at it. The fourth point here is consulting with other professionals and healthcare providers who work with children. So why do we do that? For example, a child is having few issues, few developmental issues as well. So that is taken care by obstetric pediatrician or pediatrician as a whole. Okay. Then the other professionals are the special educators, the occupational therapists are there. Then there are their speech therapists are there. So the different type of special therapies are there, and the different professionals are there who are important in the field of child psychology altogether. So this is a holistic approach that is there in child psychology. So the therapies are, as I was talking about, these are the interventions basically. So the first one is art therapy, which I already told you that draw a person test. The second one is house tree person test. So these are few tests that we can administer on them. The second one is behavioral therapy is there. The third one is child-centered play therapy. Then child-parent relationship therapy is there. Then child anger management therapy is there. Then child trauma therapy is there. Then CBT we all are aware of, that cognitive behavioral therapy. That is different when we deal with a psychotic patient than when we deal with the children, when we deal with normal population of adults. So this is quite different for each approach. Then dialectical behavioral therapy is there for any kind of personality issues are there. If seen into any kind of any kids, any kind of personality issue or personality disorder, in which we apply dialectical behavioral therapy. Next one is emotional focus therapy. All kind of emotional problems are dealt with through this therapy. Group or family therapy, where the whole family comes together for therapy towards the issue mainly concerning in this area is for the child, where the whole family comes up for this resolution. Next one is music therapy. Then occupational therapy is there. Occupational therapy, as I already told you, this is done with the help of occupational therapist as well, and it is a collaborative work of a child psychologist and an occupational therapist. And then the next one is parent-child interaction therapy. So there are many times it is seen that there is no communication like fluency in a child and a parent. So that is important in this particular factor. The next one is qualification of a child psychologist, like to practice in India mainly. So first to pass your +2 level examination, that is 12th standard pass earlier in any of the field. And if you are having a psychology as a subject, that will be helpful for your bachelor's basically. That will be very easy for you. Okay, the next one is graduation in psychology. Apart from that, if you have done your graduation in any other subject, that is also completely fine, because many of the universities takes up like their intake for master's program is they can come from any field. So there is no such issue if you are not having your bachelor's in psychology. Then the next this is important. So this has to be there. That is masters in counseling, applied, and clinical psychology. Any of the masters that you can take up, that you can choose for your master's program. The next one is you must be having some diploma or certificate course in child psychology, so as to know and the holistical as to have the holistical idea of child psychology, and to practice full-fledgedly in India. So you should be having PhD in child psychology. Apart from that, for giving certification and anything that I haven't written here for any certification. So PhD in child psychology or diploma or certificate course in child psychology can only help you with the therapeutic or the management of the child. Not so these two courses won't be giving you the idea or the ability to handle a child case if that child case is having some IQ issues or any developmental issues as such. So there this degree is important. That is again it comes to the field of clinical psychology. So in India, it is a huge gap in this. So if you are pursuing your PhD in child psychology from abroad, that would actually suffice you with all the skills that is needed and all the certification that are important for you to be fully practicing as a child psychologist, as a whole, as in India as well. So this was it.
Excuse me, ma'am. I
Yeah.
have a question.
Yes.
Like when you say like child psychologist, does that mean that we can't do any therapies? And you also said tests. Are tests different from therapies?
Yes, of course. Test is different from therapy. So tests give you a, a baseline, a idea where the child is actually onto. So let's say a child has approached you with some emotional problems, emotional and behavioral issues. Now, the parents will be telling you all sorts of things like कि खाता नहीं है time पे, खेलने चला जाता है, then let's say doesn't behave properly, then doesn't
Yeah.
go to school. So these are the chief complaints from the parents.
Yeah.
You can't be directly questioning to the child, why do you do that? What makes you do that? Because he or she won't be able to understand ki, why this third person is asking me about my things that I'm already getting scolded from my parents. Like, why is this person asking? So for this kid, like, how are you going to deal with this issue now? So the tests are made in such a way, like this house tree person test, or let's say draw a man test. So these tests are made in such a way that the child has been asked to make a figure of a human, a figure of a house, a figure of a figure of a tree. So he or she will be very happy. कि हाँ madam ने ऐसा बोला, so okay fine, a tree, okay, coloring and everything. So they will be happy. So there will be a flow of thoughts. So so that is a different test, and that test is having different interpretive idea as well. For example, an apple tree actually signifies that the child is in need of nurturance. Okay. So so there is a whole list of that. Okay. So what kind of
So would we be looking into those tests in our sessions, like coming sessions, or does that not cover up?
Okay. About the test, we are talking into the advanced section, I guess. And this section, the basic section, would be only covering the developmental thing.
No,
And
I mean, like in future sessions, do we have? I mean, will we discuss about it?
yeah.
Yeah.
So we would be discussing about it. So for these kind of tests, there are proper workshops for this, basically. So where the whole thing is shared with you, and the proper channelization of the test is explained. Okay.
So we'll know about the basics of tests here. And so if you wanted to specialize in that, so
Yeah.
we'll have written more workshops and
So
stuff.
basics definitely I'll be sharing. And apart from that, let's say what kind of need or conflict the child is going through, or what kind of
Because
environment.
I'm sorry to interrupt. I'm so sorry to interrupt. Because basically my interest is to deal with schools.
Yeah. Okay.
Yeah, though I am right now in software and all, that is totally different. But my plan for my future, I mean, like
Plans of
near
future.
future, is like I wanted to concentrate on schools. I feel like I wanted to work with children
Mhm.
from, like how you say, like from childhood to adolescence. So in that case, I'm just thinking about like mastering in that, like getting prepared. So I
Yeah.
wanted to know the steps. That is it. Yeah.
You should be
Thank you.
actually very accustomed with all these things, so as to be you to be confident about like dealing with the kids. Yeah.
Yeah,
So
yeah, that is why, because we can't abruptly go brand a child. We
yeah.
can't abruptly go say just it is because of this developmental problem he's doing this. No, we can't do that to a child. That is why I just asked. Thank
Yeah.
you so much.
I'll be
Thanks.
there. And apart from that, as I was saying that, let's say a kid has come to you with the emotional problems, so you're not able to understand. So there must be many of the conflicts, which is why the child has been into some like showing some problematic behaviors. So to understand that, then what are the tests that you can configure all those needs or the conflicts? So that is child apperception test. Like for adults, that is thematic apperception test, TAT. This is CAT. So CAT will be so there are 10 cards in total, and the child has to make a few stories for each of the cards, and where you will be able to even configure the IQ range for the child. So everything comes up into that CAT. So that is interesting and very time consuming as well. Unless you are like too inquisitive कि हाँ करना ही है. So that is what CAT is all about. Yeah.
So it would be different for the adolescents also?
No, for adolescents till the age of 12, we can do CAT, and after that we can do TAT.
But that would be then again different from an adult testing, or it would be same?
So basically for TAT, there are 31 cards basically. So for child, there are concrete 10 cards only. And for TAT, there are 31 cards, out of which you need to sort down the card according to the problem of the child. So you need to configure that from those 31 cards, you need to sort that out for the 10 cards, including one blank card in the end. So accordingly, we need to administer. So that is a like huge process for TAT.
Okay, so how in this case, I mean, how about adolescent who is having severe anxiety? Would that child you be that prepared to go under these tests?
Yeah, sure, bilkul. Definitely, because that will be giving you all the rather than I would suggest let's say for a kid for adolescents who is 14 years and above, so we can administer Rorschach onto them so as to have the pathological idea of that kid as well. So that will be giving you much more practicable, or let's say much more holistic personality issues, or let's say the personality outcome of that kid. Rorschach would be better.
Okay.
So CAT and TAT is all about more holistic, because I personally believe that TAT is much more onto the therapeutic intervention, because through that we get to know about the need of the child, the need of the surrounding, the conflict areas, the defense mechanisms. So from that we can accordingly we can formulate the case for the therapy. And in the Rorschach, we get to know the pathological or the neurotic or the psychotic side of that kid that might be leading to some other factors in their later life. So, so accordingly, we can configure that. So TAT.
What is it, ma'am? Like you said TAT and Roshant. I don't get it actually.
Okay. So there are
Sorry.
these two important projective tests. Okay. One is thematic apperception test. Thematic, THEMATIC. Thematic apperception, APPERCEPTION, apperception test, and the other one is Rorschach.
Could you please repeat, ma'am?
Yes. Which one?
Two projective tests, and the first one is schematic upper section test.
Perception test. You can, if you want to have a outline of this test, you can go through the video.
That is TAT.
TAT. We call that TAT.
Okay. Okay.
The one is Rorschach.
Please repeat it again, ma'am. I missed the things. Thematic perception test.
Thematic. Just a second, I'll just write it down.
Yes, please.
One is
That's that. That's better actually.
yeah. These are the
Great, ma'am. Great.
tests in the field of psychology. Like there are n number of workshops that has been conducted, that are being conducted by different psychologists for these two tests, and how to for Rorschach there are 6 systems to analyze that. So the most difficult and the most comprehensive one is the external system for Rorschach. So these are like too much onto complicated areas that we are getting onto. So we would be sticking to the lighter versions. So thematic apperception test is for the adult version, for like after the adolescence, and then adult version is TAT. For children till the age of 12 or 13 years, it's let's say for the 15 years as well, it's CAT, children apperception test. Basically, it depends on the child's maturation as well, so as to handle the cards that are there on there in TAT. Okay, so
Okay.
depending on that.
Thank you, ma'am. Thanks a lot.
Sure. Completely. Is there anything that anyone is thinking of asking, or any kind of
So do we need any kind of specialization, to be done for conducting such kind of tests?
yeah, absolutely. So practicing like through so let's say how do I explain this? So there are two versions of explaining this questions of yours. Is that for Rorschach test, let's say a couple is going through a divorce, and one of the spouse has actually said that कि ये इनको mental disorder है, मेरे को इनके साथ नहीं रहना. Okay. Now that so according to the law, they can actually come to mental hospital and get a Rorschach test done by licensed psychologist. And if the results come like according to that, any pathological or say any significant mediation has been found in the results, then the wife or the husband, any of the one, like whosoever has the problem, can get the divorce on the basis of that. So it is that important. So for that, licensing is important. Otherwise, you can practice that, but then you won't to do any kind of reporting as such, or let's say you won't be able to give in written ki इन्होंने लिख के दिया है. That would be questionable. Like if Rehabilitation Council of India gets to know about that which will be again like a fuss for any individual who goes through that. So that was so for all. So there are n number of things that are there, which is why in India it's very important to be a clinical psychologist first to have the RCA licensing. कि ये कर लिया, आपको क्वेश्चन नहीं करेगा, बहुत हो गया, ठीक है. So that is the reason that everyone is fighting for this, and the seats are like this much in India. And that is like a very big drawback for India in mental health terms. So yeah, so even in the next 10 years, we all our colleagues and all our batchmates have been have discussed over that we would be like raising few of the campaigns to actually ask the government to at least raise the seats, because there are n number of aspirants and the need is so much. Like in our hospital, the intake is for everyday OPD there is 130 to 150 patients every day, excluding excluding Sunday. So Sunday we have to like keep it close because it's so much. Same goes for Agra, same goes for the CIP2 institutes, same goes for Nimans. Nimans का थोड़ा ज़्यादा है उससे. It is around 300 to 400 OPD patients each day. So that is what the intake is all about. But then the doctors are this much, so that becomes a heavy toll on us as well. So that is all. That is it all about. But if there is any question that is popping up regarding anything, I would be happy to answer.
Ma'am, I have a personal question. Actually, nowadays, the student, those who are in 9th or 10th grade, they're very much pressurized with like tuitions, then coaching pressure, then school pressure, then extracurricular activities. So they're not able to manage the things properly. So they're getting stress very easily. So the stress, anxiety, all those things. And they're getting frustration. So how to deal with the situation, with such type of situation?
So firstly, personally, I belong from Noida. So I'm very well versed with all the Delhi NCR schools. So the main role here comes for the school counselor who are dealing with such cases and dealing with the school curriculum as well. So here there should be like a monthly, like there should be mentors for each of the children, the group of children, so that they can check upon each of the child that what kind of if there is any sort of issue, and also the school should be having having this conversation with the parents as well, and giving them the opportunity if there is anything that the child is coming up with, and if they are if that is visible in home, then they can inform to the school and the school counselor can take the charge upon. So these kind of few interventions can be used, especially for the kids in 11th and 12th standard. That is very, very important for them to have this. And mental health should be introduced in the from the standard of 8th standard. That will be very okay. And in our field, we come up with the idea like what is the correct age when we can deliver the education of sex to the children. So that is basically 9th standard. So where the or 8th standard, where we can actually deliver the whole idea of what sex education is all about, and a brief is given in the from the standard of 8th and 9th, and then the holistic thing is given in the standard of 10th and 11th and 12th. So this should be done. So similarly, like sex education is important, then mental education, mental health awareness is also given for this school, like the middle school, basically middle school you hoga na 8th.
Yeah.
So senior
Ma'am, how do we show empathy towards such kids? Like,
okay.
no.
तो बेसिक सबसे पहले तो ये है कि जैसे तकिया होता है ना, a pillow, ठीक है. So basically you have to be like a takiya all the time.
That means
That
We
means
have to take all the bash.
so that you can take the whole so if a kid is approaching you, firstly you should be having a very like a bit of
Very supportive. We have to be very supportive to the kids.
supportive रहना है. You should be like whenever the kid is meeting you, you should be grumpy first of all. Even if you are having like 1,000 problems, if that kid is approved, you should be very
You are correct. Correct.
एक छोटा सा स्माइल बहुत बड़ा काम कर देगा.
yes, exactly.
Pat on the shoulder, that is it. कि वो घर पे जाके बताएगा, that kid will be actually informing their parents कि आज ना मेरे को ऐसा किया. That is such a big thing for children. If you have heard about this Pygmalion effect, if anyone has heard about it, Pygmalion effect. So Pygmalion effect is basically, even I personally tell school teachers that you should be actually implying this Pygmalion effect. That is that a child, let's say a child is not good in maths, okay, and the maths teacher actually says to that kid, कि अरे अरे होगा, तुम कोशिश करो, नहीं होगा, आई एम देयर, बट तुम करो, मुझे क्यों लगता है कि तुमसे होगा, why do I feel like you will be able to do it, I am fully confident over that. If you fail, I am there, but I feel that you will be able to do that, and a pat on the shoulder, and that is enough for the kid to perform like
Correct, ma'am. Correct, ma'am. Correct. Yeah, correct.
Throwing up the confidence, giving it the confidence, like
That
I'm
motivation
confident on you
is
rather
there.
than, yeah.
because
That motivation should be there actually.
for children, we as adults are already like something where they get very intimidated. Like, what will happen if I tell her or him about this? What will
Yeah.
happen? कि बड़े हैं यार, नहीं वो तो they are
And
adults.
also sometimes that becomes a gossip itself. If a child goes to the counselor,
That becomes a very big
very big issue, that if a child meets the counselor and says a hi, talks to the counselor, then that becomes a big gossip behind, like, oh, she had met the counselor, so there is something wrong, something going on, and that becomes a very big gossip. And that's why children doesn't wanted to come and talk to the counselor at all, because at the first point they don't want others to think anything wrong about it or mistake. They speak whatever they wanted to, right? So they don't wanted to get caught into that gossip, so they don't come and ask for help at all. So is it okay to keep it a secret, like not showing off? Is that all right?
So I'll tell you, no, that would be like very much hampering for the child in his or her class. कि अरे तू गया था वहाँ पे, तू गई थी वहाँ पे, ठीक है? So
Suddenly, I mean, can you please tell that somebody else? Can you help me with English for that?
sure. That कि oh, you went there, you went to the counselor. So is there any issue?
Yeah.
That has to be covered by the school counselor itself, because she has to actually like approach the child ki whatever like it has to be very okay with the whole school that visiting visiting the visiting to a
Counselors.
fine.
Okay, it is normal.
Yeah, so there should
We
be
should
one
normalize that.
there should be one holistical class for the for each standard, that this period is mental health period. Okay. The counselor will be coming and teaching you some of the issues, or let's say if any open fight is there, कि ये और इसमें हमेशा लड़ाई होती रहती है, like this person and this person always fights. Then few of the metaphors are used, few of the group activities are done. So these should be done by a school counselor, which is not been into practice in any school, like holistically, none of the schools are practicing.
Yes, yes, you are correct.
Yeah. So if it starts
No, counselors are there, but they're not allowing students properly. They're not giving proper guidance to the students.
Yeah.
Why? Because that is the easy way of making money. And that is like, yeah, it's a school counselor job. Yeah, what is, nobody will come to me. Yeah, I'll just sit there and have my cup of
It
coffee.
is just for the sake of formality.
Yeah, that's for the sake
Yeah.
of kept, and maximum of the counselor are not even having the proper degree to handle that.
Degree, yeah.
Let's say the
Mhm.
proper exposure to the issues that the child faces through, and the knowledge to to deal with that. So that is the issue, that the counselor also is not very confident to go there and tell the whole school ki I'm there, come to me. All these are the curriculum that we are going to channelize, and telling the principal and getting the things done. So that has to be the job of the counselor itself. Like they have this vacancy for school counselor, but then the other part of the job and getting the shape of the school is the job of school counselor. After she joins or he joins the school, then he or she should take up the charge for getting all these activities done in the school.
I would like to say something.
Sure.
Yeah, I work in school as a coordinator, and I've been working for past 10 years. But I have seen this particular year wherein after Corona, and I work for kindergarten basically. So
Wow.
yeah, I
You
have
got the right person here.
yeah. So I work for kindergarten school. I have been working for the primary school, but I started enjoying working with kindergarten more. And then I just grew up and I just got promoted, and I'm working as a coordinator. But the main reason for me to join this course today was that after this Corona, when I went into the school again, I saw a very, very, very different set of students, very different emotionally, not challenged. I would like to, throughout the journey, I would really like to come up. When I got this introduction with you, I really felt that this is the place where I could get the answer for the questions, because I don't know how to handle those children in spite of my so many years of experience. They are intelligent, they are sharp, but they are timid. I can see the opposite. Probably they were inside the home for all these years and social behavior is different, but I can just, throughout the journey, maybe I'm finding the answers for the same. Same goes. I have got 2 teenage daughters. My elder daughter is in the degree college. The second one is in 12th grade. I am really amazed, I mean, not amazed. I am really lack of, answers at how to deal with them. So probably throughout the journey, maybe I want to find the answers for all my career as well as my own children to deal with.
Yeah, surely,
So
surely.
I don't want to open up all the questions now because it's already time up, but throughout the journey, so
Yeah.
many experiences I want to get answers for.
Yeah, surely you will be getting
Yeah.
answers. And me being in this field and me being working in this mental hospital since past 2 years, I have got so many answers to my problems.
True. I have been a person with a childhood trauma. I want to find the answer for myself also, my childhood trauma, my career wherein I deal with children and my own children. These 3 fields I want to find answers for.
Yeah, of course. Same with me because I have 2 children. Like my elder one is in the college. He's doing his first year medicine. And the younger one is like +1. He's into +1. And both children are like 2 extremes. So totally different children. Like one doesn't need any care at all. I don't even know how his handwriting looks like. And only day before yesterday, I saw his notebook and asked, is this how you write this smaller? And that's when I realized, like, I don't even know my second son's handwriting, like how it looks and how he writes. But with my elder one, I was always behind him, looking at him, watching him, attentive to him. I've been taking care of him so much because he was in need of that much of attention because he's very distracted. The younger one is kind of very organized. Even during the COVID, he was kind of like with his online lessons, he does his homework. I don't know where does he got that kind of discipline from because I'm not that disciplined at all when I was a child. And I see myself in my elder one. So I was able to like correct him. I know where he's going to go. I know how he's going to get distracted. I know how to bring him back. So I thought like that's more interesting. So when he went to the college, he was totally a different kind of child. So everyone have their own experiences. It's so nice being here with different people, like with different experiences, different kind of children, different psychology of children, to know many things. Yes, it's nice knowing you all. I'm so happy for the day today. Yes.
Best part is we are going to learn much more.
Yeah.
Yes,
absolutely,
exactly.
absolutely.
A great journey ahead.
Yeah. Keep on adding anything like we would be having these kind of discussions that would be actually giving me the idea that what are the other things that I should be adding on to and what kind of examples that would be helping you to understand better what concepts I am trying to deliver. So that will be much more helpful. Yes.
Thank you.
Yeah.
Thank you, Ria. Thank you so much.
Thank
so
you.
much for-
My daughter's name is Ria, so I can very easily connect to you.
Surely, ma'am.
Yeah, thank you.
Thank you. Thanks a lot. Good night, everyone. Good night.
Good night.
Good
Good
everyone
night.
closing this
Bye.
session. Thank you.